Good evening, folks. Welcome to our top MCQs for USMLE. I hope you are doing well. And as you prepare for USMLE, you should study high yield material. That's very, very important. And you should also know what to study and what not to study. Okay. For example, if you are studying about a cancer, you should know what type of cancer is that. They don't want you to know the exact doses of chemotherapeutic agents you use to treat this cancer. Okay, so don't spend time studying about the doses of radiotherapy and chemotherapy and all that stuff, but focus on how to diagnose that particular cancer based on unique characteristics. All right. So that kind of preparation helps you to get a top score in USMLE. Let me give you one MCQ today that helps you a lot to understand this concept. Also, for these kinds of questions, visit supertestscores.com. They have like 1400 MCQs just for $10. Okay, very top MCQs, 1400 MCQs just for $10 so that everyone can afford this. So visit that website and get this question bank. I mean, believe me, you will save a ton of money compared to some courses like Kaplan is offering. Some of the courses they are offering is like $10,000, folks. That is insane. You don't have to spend that much money. With a very low budget, you can get a very top score in USMLE and land in the residency program of your dreams. So let us see this MCQ today. A 15-year-old male presents with a 2-month history of progressive pain and swelling in his right distal femur. He reports that the pain is worse at night and is not relieved by rest. On physical examination, there is a firm, tender mass palpable over the distal femur. X-ray reveals a destructive lesion with a sunburst appearance and periosteal reaction. What is the most likely diagnosis? A. Osteosarcoma. B. Ewing sarcoma. C. Osteosarcoma. D. Giant cell tumor of bone. E. Chondrosarcoma. So, look at this question. We have a 15-year-old male and he is having pain in his knee joint. It's not relieved by rest. And on physical examination, you find a firm tender mass palpable over distal femur. And on X-ray, you see a destructive lesion with a sunburst appearance. We have 5 choices: osteochondroma, Ewing sarcoma, osteosarcoma, giant cell tumor of bone, chondrosarcoma. So what is the correct answer? The correct answer is C, osteosarcoma. So it's very easily you can imagine this scenario. This is an adolescent patient with a tumor in the distal femur. That is the most common location for osteosarcoma. By the way, osteosarcoma is also the most common primary bone tumor in children. Okay, that also helps. So you will be asked on this because it is the most common primary malignant bone tumor in children and adolescents. So in USMLE, you will be tested on the most common things. They want you to know most common things, how to diagnose them. So when you see this adolescent with bone pain not relieved by rest, there are a ton of things. But they also give you specifics. The specifics here is the X-ray finding, the sunburst appearance. That is specific to osteosarcoma. So if you see an adolescent patient with sunburst appearance or Codman triangle on X-ray that is osteosarcoma. So that is the super formula here. Adolescent patient with bone pain not relieved by rest, and osteosarcoma comes in the metaphysis of long bone, sunburst appearance on X-ray, Codman triangle, osteoid producing tumor cells, and it is also radiation resistant. And the most common site of metastasis is lung because it spreads through blood. All right. So don't choose brain or liver or lymph nodes as the primary site of metastasis. So some questions come like, what is the primary site of metastasis? What is the most common site of metastasis in osteosarcoma? The answer is lung. Okay. So that is the super formula here. Super formula is about clinching the diagnosis based on very specific things. Okay. Certain things are specific, like for example, water. What is so specific about water? It has a specific molecular structure, H2O, that is specific to water. In the same way, everything in the universe has certain specific things to identify it. That's where we have super formula, identifying something based on its unique characteristics. So for osteosarcoma, those are the unique things. An adolescent with bone pain, especially in the distal femur, and the pain is not relieved with rest. It is appearing in the metaphysis of long bone. There is sunburst appearance on X-ray. There is Codman triangle. It is radiotherapy resistant. Lung is the most common site of metastasis. If you see those things, you can go directly to the diagnosis, that is osteosarcoma. And why not the other things? Why not osteochondroma? Osteochondroma is a benign tumor and it just comes like a protrusion, so it's not a malignant tumor. Ewing sarcoma is also a malignancy in adolescents, but you will see onion skin appearance, and it appears in the diaphysis of long bones. Giant cell tumor, it appears in young adults and it is located in the epiphysis, not metaphysis. Chondrosarcoma is a cartilage-based malignancy that typically occurs in older adults and rare in adolescents. So that's why those answers are wrong. Okay, you see, basically you are separating them based on clinical features. Age also helps you. For example, osteosarcoma is a childhood disease, whereas chondrosarcoma is an adult disease. You need to know that to come to the proper diagnosis. Also, where is this cancer appearing? In osteosarcoma, it is coming in the metaphysis. In Ewing's sarcoma, it is coming in the diaphysis. In giant cell sarcoma, it is coming in the giant cell tumor of bone, it is coming in the epiphysis. So based on that particular region also, you can think of the diagnosis. Okay, folks, that's about today's MCQ. Please visit supertestcourse.com. You will find 1400 and counting. All right, these questions are being added by board certified physicians to help USMLE students and NEET students. Okay, so 1400 questions and counting, and they are available only for $10 to all USMLE students. So use these MCQs and I assure you, you will definitely get a top score in USMLE. Thank you so much, and I will see you in the next episode.